To get you guys quiet. Happy Thursday morning. It's a great day to be here at Eggs and Issues. I'm April Bragg with the Chamber, and I just want to thank you for being here. We just heard from Synovus and earlier House and Healthcare, our presenting sponsors, and at this time I'm actually going to ask Ron Weigel with with Synovus to come forward for our invocation and pledge. As you rise, if you'll make sure you silence your cell phones.
Thank you, April. If you'll join me within the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please join me in prayer. Lord, thank you. Thank you for this day. You're the creator of all things. We're especially grateful for your grace. And we owe everything to you. We want to lift you up. We need you in everything. We need your help. We lean on you, and we want to lift up the family of Mrs. Robbins as her passing. She was a part of this community. We want to thank you for all the people in the community that make this what they are, and that you blessed each one of us with gifts to share with each other and use to your glory. We just ask that we continue to seek your will individually and collectively, and we ask that you keep us safe so that we can do your work. In Jesus' name we pray. Amen.
Thank you. You may be seated. Before we begin our program, I want to take just a moment and thank our sponsors. As I mentioned, Synovus and House and Healthcare. Georgia Power is our silver sponsor. Middle Georgia State University sponsors our menu every month. And then this month we have a special program sponsor who is new to Warner Robins, but certainly not new to providing quality health care and memory care. Specifically, I would like for you to please join me in welcoming Bob Goodwin with the Canopy at Warner Robins for a few words. Bob. Yes, you got fan up.
That's too funny. Well, good morning, everybody. For those who I have not had the pleasure of meeting, let me introduce myself. My name is Bob Goodman, and I'm excited and proud to say that I'm the Executive Director at the Canopy at Warner Robins. Let me also introduce the other member of the team. There's two of us right at the moment. Our Director of Sales, Rebecca Chambers. And we have been affectionately dubbed as the dynamic duo because of two things. One, our passion to this industry, and second, that we work pretty well together. We do all right. We have both been in this industry for a number of years, the senior industry, and we're excited to have the opportunity to be see a brand new community that we're seeing being built basically from the ground up. If you're not familiar with the Canopy at Warner Robins, we are located off of Highway 96, right behind Robbins Federal and Synovus Bank, and in front of a little community called Mayberry. We broke ground in early February, and even though our website states we're opening in spring of 2020, Rebecca and I are really hoping that it will be sometimes more toward the end of the year. The building will be done, and then we'll start bringing residents in around the February timeframe. The Canopy at Warner Robins is going to be a beautiful, as you can see it here, 64-suite senior community. Banner. 44 of these suites will be for our assisted living residents, and 20 will be dedicated strictly for our memory care residents. If you've been in a position, and I have and Rebecca has, where you've had to place a loved one in either assisted living or memory care, you know that it's not an easy journey or decision to make. Rebecca and I want to make this journey as easy as possible. We want to provide you with as much information as needed so that you can make the best decision possible on what direction you want to go in. This is going to be their home, and we want them to feel like that this community is their home. Let me give you really quick some of the services and amenities that we're going to provide to our residents. Wide range of services and resort-style amenities such as artful dining, which will include 3 daily meals prepared by our chefs that will be served restaurant style, zestful activities, and heartful care. Residents will be provided with services and programming that will support the body, mind, and spirit, and include around-the-clock care managers and full-time licensed nurses that are on call 24/7. Wellness programs and activities, scheduled transportation, special events, and road trips to local areas of interest provide residents a fulfilling lifestyle. Other things, a place where the residents can enjoy a good movie. We're going to have libraries. We're going to have a bistro. Happy hour is going to be provided every day. That probably
They've heard
covers
enough.
everybody. Within the community, don't get too excited now. There are going to be allotted 2 tickets per person, so you can't get wiped out, all right? Within the community, where the assisted living residents reside, there's going to be a big courtyard. Within that courtyard, there's going to be a putting green, so if you're a golfer, this would be a great place for you to come. And the one thing that Rebecca and I are real excited about is we are pet friendly, so we can accept pets. We're going to have a doggy park, and we think that is going to be huge to the residents that move in. Our company's philosophy is built on 2 principles: treat others as you would like to be treated, and the 3 C's character, compassion, and commitment. Finally, we do have a wait list. So if you know of anybody that would like to pursue and look at this, please come and talk to us. We'll be glad to let them know about this program. And again, after this program is over, Rebecca and I will be in the back, and we can answer any questions that you might have and provide you with any more information. Last, on behalf of Rebecca and myself, we want to thank the Robbins Chamber of Commerce for this opportunity to let you know about the Canopy of Warner Robins. We're excited to be a part of this community. I hope you enjoy the rest of the program, and thank you very much.
Thank you, Bob, Vanna and Associates, for that presentation. So here's one thing I do want to say, on Bob's behalf as he's, making his way back to the table. I want to thank you, first of all, Bob and the Canopy, for your investment in choosing Houston County. We all know it's a great place to live. It's a great place to raise a family. It's a great place to do business. It's a great place to bring your senior family members, here. But Bob hasn't even opened yet. They've got a waiting list, and he's been actively involved with our organization since day one. So I just want to, just thank you on behalf of our community. So it's no secret that access to quality health care and amenities are critical to economic vitality and growth, and we are blessed to have an industry leader here in the world-class health system that is Houston Healthcare. I'm going to ask that Charles Briscoe go ahead and make his way to the stage. And at the top of the program, you saw a quick clip about a national award, the National Trainer of the Year that was received by an employee here in Houston County. And I want to show you a clip with a little bit more about the athletic trainer program as we get set.
Preparation and attention to detail are keys to a successful outcome. At Houston Healthcare, our team of trainers and emergency personnel spend countless hours making sure that we're just as ready for game day as the teams we serve. From training room to sideline, our work starts long before the lights go on. So when it's time for us to take the field, we can provide the level of healthcare our athletes deserve. Houston Healthcare, supporting every player to get every game best play.
Good. Charles, thank you so much for being here this morning.
Thanks for having us. Glad to be here. We look forward to it every year. And let me just start. I want to recognize just a few people before we get into the discussion. But first off, I want to recognize all the elected officials here today. I know that there is as happens from time to time in Houston County, we got a lot going on, and there are a lot of activities. And this happens to be one of those mornings where there's one right after this. So I understand a couple of the elected officials and some from the base have kind of a hard stop and might be stepping out early. And we understand that and fully support you doing everything you got to do for the community. But to the elected officials, thank you for your support. Those of you on the base, always goes without saying. We just can't thank you enough for your commitment to our community and to our country and everything you do to keep us safe every day. Also want to recognize we've got a couple of board members in the audience. didn't exactly see who everybody walked in, but I see Mr. Warnock here. If you just raise your hand, Dr. Larry Warnock, Mr. Larry Warnock, and Dr. Ivan Allen just walked in. On our board, I want to thank those guys always for the support they give us and guidance that they give us on all the matters that we have to face every day. Then our executive team is kind of scattered. If you'll just raise your hand. Executive team, these are the guys that I said, help me with the agenda for today or you will join me on the stage. So we have a robust discussion today.
Got a lot of help.
So thank you, team, to everything you do to help us. Also, Madeline Davidoff, I want to recognize her. Dr. Davidoff, we'll talk about her in just a second, and Dr. Doug Skelton. Some of y'all may know him from previous years in the community, and I'll come back to them a little later with a special announcement today. But I do want to recognize, this was mentioned at Exit Issues at one of the ones in the past back in the spring, but since it's our day, sort of as House and Healthcare, I wanted to just take a moment to recognize the passing of Art Christie, who was a board member of ours for 10 years, long-term administrator for the health system. It was a significant loss for us, and just wanted to, again, I know it had been mentioned, and we had a moment of silence for him earlier in the year, but since it was our day, we wanted to recognize him again. But tremendous person in our community. That vacancy of the board, just so you know, was filled by Dr. Gil McEver. So Dr. McEver's been with us now about 2 months on the board. But with that, thank you everybody showing up this morning. Look forward to a good discussion.
Absolutely. Well, I think the thing that's on everybody's mind, and I've been asked a lot, if we're going to talk about, is the latest on the proposed strategic partnership with Navicent. What can you share with us?
Yeah, let me start by saying both parties very much committed, very positive. Which is good. This is going to happen. The part where we are, the unfortunate part for this morning is there's very not much I can say. We are in in January we were granted approval by the Attorney General of the state of Georgia, which is a significant step for our proposed partnership. And at this point, we're in the final stages of a federal review, and we're optimistic that that's going to go through here real soon, and we can get on with proposed partnership in the near future. I do want to say to those of you in the room, a lot of you in the room, part of this process, both levels that I just mentioned, required documented letters of support from community leaders, businesses, and let me just say, without, again, can't go into much detail about it, but the support to us locally, to our team, who's not necessarily locally, has just been overwhelming and very impressive. And I can't thank you guys enough, and there's those that aren't even in the room, but the support that has been documented for our health system and for our essential proposed partnership is just overwhelming, and I cannot thank you enough for those of you that participated, and there may be more support needed, and I'm sure you will be there, as is the case in Houston County. If it's something we need to do to better our county, there's partnerships and ways to get things done, and it's just very impressive and awesome what we've been able to pull together in terms of a community support and representation. So thank you for your hard work and commitment there.
Well, we're excited to see this move through the approval process, and I think everybody is happy to help in whatever way we can. So another kind of new shiny object for House and Healthcare that I saw on the news just earlier this week is a surgical robot that you guys are getting. Can you tell us a little bit about that, acquiring that, or when it's going to come online, and then what it'll be used for?
Yeah, I can. And let me, the robot for us, it's a new shiny thing, but in fairness, it's not really a new technology. It has been around for a while. I don't know the exact date of its development, but it's been in hospitals since the early 2000s around the country, and there are robots throughout the state of Georgia. But it is new for us, and it is an intuitive Da Vinci XI robot. That sounds like, Star Trek kind of stuff, but it is here. We will hope to be doing cases by the end of the year. There's some training and operational aspects to bringing on this modality in our hospital for the first time that we have to go through and make sure we're doing everything just right. But I've got a couple of pictures. Again, it's sales type stuff, but We had this, we've been taking it around town this week. We had it in the lobby of the hospital, we had it here in the pavilion, and then we had it over at Houston Lake Country Club last night. This is not something you can hook up to help your golf swing, although it does look like it might have some of that to it. But this is essentially the robot that goes over the patient. You can see there in the picture, you know, some folks have trouble sort of thinking through what is the robot, how does it work, but that is the actual machinery part of the robot that you can see over the patient. Right here is the console, not the size of a refrigerator basically, that sits over in the corner. The physician there you can see in this picture is doing the robotic work on the patient from the other side of the room. Your surgeon is always in the room. Your surgeon's never, you know, this isn't somebody sitting in Texas operating on you. Surgeon's there. If something goes wrong, the surgeon gets off the console, they undock the robot, and they take care of you. But you know, it has great benefits. It is minimally invasive, so the thing was designed, frankly, to take open cases, to close cases, and to allow access to parts of the body that frankly the human hand can't access. So it's a really cool technology. Again, in fairness to those around us in the market, this is not a new technology in the industry, but we're excited to have it here at Houston Healthcare. It is very new to us and very exciting for us. It's a little under $2 million in capital investment. We will do, out of the gate, it will primarily be a general surgery modality. We have several general surgeons on our staff that are already trained and competent and more than eager to get started on the Da Vinci robot. And then we have some of our existing medical staff that has also raised their hand to train, and future service lines will be continued growth of general surgery, GYN surgery, and hopefully urology surgery in the future. And then actually the biggest growth that we're being told in the robot modality is the bariatric surgery. That is advanced to the point where it's primarily a robotic modality. So we hope to get into that at some point in the future, hopefully in 2020 as well. So just a really cool piece of equipment for us. Our staff's excited, our medical staff's excited. Again, it's just one of those things, I gotta thank the board. I mean, it's a leap to go $2 million in and try to get some surgeons to do something completely different. And that's what we're doing, and we're excited about it.
It's an exciting investment, an exciting opportunity to see what comes of that. So it seems like just last week, but I think it's been a month or so ago that we had a ribbon cutting down at the Perry Hospital announcing the opening of the air evacuation system there on that campus. And I understand that you're working on a helipad for Houston Medical Center as well. Can you elaborate on that?
I can, but let me first back up before we get to the helipad, if I could. One of the service lines, there's many service lines obviously that you would need air transportation for, trauma, cardiac, you name it. I mean, you guys know that and have seen that in the community, and hopefully not too many of you have experienced it. But the main service we've started, I told you about this last year, if you were here last year, we were looking to start it into December. We got into it actually mid-January. It's just been a huge success for our hospital. But we really needed an improved framework for delivering stroke care in our health system. And in January, we entered into a relationship with the Marcus Stroke Center out of Grady and Emory to provide teleneurology. Now, I'm coming back to the robot, just bear with me, but it's been a huge success. And what we have there is through telemedicine in our emergency rooms at Perry and Houston Medical Center, if you come in with stroke-like symptoms, they go through some basic tests and they can pipe you in essentially to these board-certified neurologists that are at Grady and Emory to assist our current local medical team in the assessment of that potential stroke case. Perry is seeking a stroke-ready designation, and Houston Medical is seeking the primary stroke designation. And we will achieve those. We'll probably sit for that in the spring, early summer next year. But I bring that up relative to the robot because we were vaguely interested in a robot for clinical reasons in Houston. The helipad at Perry is more of a base station, not just for Perry Hospital, really for the community, the broader community, South Houston County, those counties that surround us. and air evac can respond as needed, again, not just for our health system, really more of a overall community response. So we endeavored to get that done, and that was open, as you mentioned, the ribbon cutting. And during the planning of the Perry Air Evac base, we decided, you know, with the stroke coming on and the stroke really exceeding our expectations, that there's some real disease relative to stroke care in our region. And we're a little overwhelmed, frankly, at what we see coming into the ER every day. So that really forced us or didn't force us, but it was really the impetus to get us to go ahead and do the Houston Medical Center helipad. So this week we blocked off the parking spaces. We've taken all the questions from the employees about why can't we park there anymore. We lost probably about 35 parking spaces, but we're blessed again to have some land on the main campus to where it was not a permanent loss. We do have the ability to absorb that. But they blocked it off this week, and I believe today, don't hold me to this, there may be a shovel in the ground today. And that's a very quick process, because again, it's not the full base. So we're not talking about living quarters and those, you know, a hangar, those kind of things. It's truly just a basic helipad. So that may be in place within 6 weeks, depending on the weather. And then we'll have a complete air evac relationship and system across our health system. So we're excited about it. But I needed to give you that kind of clinical background as to why the helipad in the house.
Absolutely. So back to the stroke. I know we talked about it last year. The stroke program. Would you say that that's meeting your expectations as far as progress and development?
I would say it's exceeding it. I'll be honest. We knew that just from our numbers, we had 10 or so a month that were getting into the Houston Healthcare ambulances that were being treated. Some treating at our place, some were being transferred from here that we thought we could provide. We have easily seen those 10 stay within our system, stay within our community, and receive treatment. The numbers, I would say, have at least probably doubled that number, if not more. And a little bit about the stroke. Let me give you just some images here. Again, I'm not clinical, so I'm going to throw up some images and use some terms that Dr. Davidoff may throw something at me and say that's not the way you say it. Essentially, again, what you have here is 2 CT scans, 2 images of a patient. You can see there's a 69-year-old female that came in with stroke-like symptoms. And I'm going to tell you at the end here how to sort of recognize that, because that's really the key takeaway. But on this CT image, you can see the red over here, and I've got the pointer over here, so I'm sorry if I can't point to all 4, but the red you see there circled is a sign of blood flow to the brain. Recognized quickly within 3 hours, we can administer TPA, which is essentially a drug that can bust up the clot that's causing the stroke. We were able to do this on this individual, and what you can't see on this red circle is this kind of detail, but you see this blood flow here in the green circle. That was not there. If you had this image on this side, you would not be able to see that blood flow. So this is restoring tissue, brain tissue, immediately with the TPA drug, restoring that brain flow, restoring function, and we're seeing people back to functionality baseline within minutes. And we can do this. Now it's a 3-hour window, so that's key to the community needs to realize this is much like we went through several years ago when we opened our cath lab with our cardiac interventions. Time is muscle, time is tissue here. So if we get you within 3 hours, there's a good chance we can administer this TPA and restore some tissue. And then just one more, in full disclosure, we can't treat everything. Our medical staff capabilities, we don't have the interventional capability. Here's another case of a 59-year-old female that came in. Again, the color of the green here is just showing the loss of blood flow. This individual was transferred out. More than likely, Navicent can do some of this, but a good number of these are going to Emory. And this, again, back to the air evac. This just shortens that time. The quicker we can identify whether we can treat it or you need to move on to some other place. Again, this top picture is before. As I've been telling the team, I don't know what this really means. I just know they're black squiggly lines, okay? Black squiggly lines are good. That means blood flow. So you can see the before picture, and then down here below after. quickly restoring blood flow, restoring functionality to the patient, and to the clinicians in the room. I apologize, I know I just botched that, but,
You got a thumbs up.
this is big stuff. This is big stuff that, is really saving lives in our community, getting care quicker, getting the patient to where they need to be quicker, and we're just, thrilled about it. And then, one last little bit of educational piece. I know we don't typically do, PowerPoints here, and I don't intend to do that. But you need to remember this. You need to take this away with you. The FAST acronym. So if you see any kind of facial droop or any kind of slurred speech, weakness on either arm, call 911 time and get somebody to the hospital. Don't jump in the car and come with, let a loved one drive you. I got my own elderly parents down in Perry, and they just refuse to call 911, and I tell them all the time.
That's what it's there for.
You're the reason we have it, so call it, okay, 911. They will not be offended or, mad because you call them out at 2 o'clock in the afternoon. Call 911 and get in. So the FAST acronym, if you hear nothing else today, when you go back to your employees, your family, remember the FAST acronym, and we can get you where you need to be if you dial 911 in this county, relative to stroke and cardiac.
That's a service we hope to never need, but it's all too much of a reality for people, so it's exciting to know that care is available here. So something a little lighter note, we've seen a couple of videos now about your athletic trainer program. You guys are probably as frequent flyers as anybody to the local sporting events. We're in football country, and so I know that's important to everybody, but I don't think people necessarily realize the extent of services that House and Healthcare provides through their athletic trainer program. So can you share a little bit about that with us?
I can, and I'll build up to that a little bit. It's bigger than athletic training. That is one, it's probably the most noticeable and attractive thing we do, I guess, on the surface. But right here in this building, we have our educare department right down the hall here. And through that department, we touch about 30,000 individuals every year through community education, be it health fairs or seminars or screening. We have childbirth classes. We have a robust senior care program where we're providing exercise classes, educational classes. Again, over 30,000 individuals that we touch every year. The athletic trainer is about 1,800 touches, if you will, the way we look at it. It's about a $400,000 investment that we make in the community. There's 5 athletic trainers, and they, as you said, they're at all the ball fields, all the practices. They're keeping our students healthy. They are assisting our students' families when they need further care beyond just the sports clinic or what can be taped up there on the field. They're interacting with the family to help them find a physician that fits their personal interest or their insurance needs, what have you. Just a great program, and I take a great sense of pride to sit out the football game and see either our ambulances sitting out there or our tent down on the sideline, and our trainers. I hope they never have to run on the field, but seeing them on the sidelines and seeing them run out and take care of our kids from Houston County, and I've even seen them run out and take care of kids from another county on our field. And that's just tremendous, and it's a tremendous thing that we're proud to provide. I will tell you a little bit about Bonnie. Y'all saw the video as we were lining up for food there. I know there's been quite a bit of local PR already on this award, but Bonnie Hitchcock's been with us about 20 years, I believe, assigned, if you will, to Northside High School as a trainer. Works, as I just described, daily with the athletes, the parents as needed, the administrators at the schools. Works with Middle Georgia Orthopedics, Ortho Georgia, the 2 orthopedic groups here in town, to help the kids, again, get the care they need. Well, back earlier in the year, a representative from Middle Georgia Orthopedics nominated Bonnie for a regional award. And I got the call, and they were telling me this, and I didn't know anything about the Newell Award. Well, just real quickly, there's a gentleman, William Newell, Pinky Newell. I don't know where the nickname comes from, but Pinky Newell had about a 30-year career as the athletic trainer for Purdue University. And this gentleman started the National Athletic Trainers Association. And if you talk to some of our trainers, they will tell you he is consistently regarded as the father of athletic training. So the Pinky Newell Award, I'll admit, to me, been in the industry over 20 years, I had no idea what it was. But when I looked at it, again, Middle Georgia nominated her for the regional award. She won the regional award and was put up for the National Newell Athletic Trainer of the Year award. And she won, right here in Houston County. Best athletic trainer in the country. Fantastic, that's huge. The award was for Northside High School, $2,500 for the school. And Vonnie, I don't know what she's done with the money, but $10,000 personal award to Vonnie. So this is a huge deal for our program, for our county, for our school system. Just a huge award. We've celebrated it a bunch of times. We're celebrating it again today. It's just a proud moment. We couldn't say enough good things about Vonnie and the rest of her team. They're just elated about this recognition, and she's fantastic, and we're just honored to provide that program.
That is very exciting. So we've got a lot of employers in the room. Want to ask, what do employers need to know about healthcare in general as far as changes, and specifically about how Houston Healthcare can help them?
Well, I think the changes, I mean, you guys see it probably more than I see it, frankly, as a provider. You see your benefit line continuing to go in the wrong direction. You see your drug costs continuing to go in the wrong direction. More than likely having to pass that premium on to your employees. You know, we're working diligently within the industry, some willingly, some being pushed by payers, frankly, to move to a more value-based platform. We talked about this last year. This is key to the need for the partnership that we discussed last year. But we see payors, employers, providers needing to come to the table more frequently and have discussions about how can we work collaboratively to improve the quality, lower the cost, get more efficient costs, more appropriate utilization. So not necessarily the four walls of the traditional hospital. That's becoming more and more every day a dinosaur. And we're needing to find lower cost, ambulatory-based, retail-based settings for care. We see it, the most obvious thing we see in our system is just the continuing transition from emergency room visits to urgent care visits. We see every month when I see our volumes, I'm just amazed at the urgent care growth. As just numbers continue to go. Now we see it a little bit the other way on the ER side, but that is driven by the payer, probably driven by your benefit plans. And as a provider and an employer, we have the same thing. So I understand that. So, you know, that's what we see. The trend is really not new. It's continuing. We've heard about it over a couple of years now. What we can do to help you, I would just encourage the dialogue. So let's sit around the table. Let's talk. We've got partners. We have some clinical integrated networks that we have with our physicians, with Patient Select and Stratus, and we've got other entities like Secure Health that we're affiliated with that can entertain a conversation with us and the employers at the table. Again, we don't know all the answers, but we know who's got to be around the table to figure it out. And it's most of you in this room, and we'd be more than honored and interested in sitting around the table and having that conversation with each and every one of you as you are seeing your benefit line continue to creep up, and you need to look for creative solutions. We'd be interested in partnering with you.
Very good. As we anticipate cooler weather, I don't have any indication that it's coming. Right? But flu season is likely on the minds of employers and employees alike. Anything you can tell us in your crystal ball about upcoming flu season? Anything else you'd like to elaborate on about that?
Well, not a crystal ball, but get your flu shot.
Yeah.
That's so now we're up to two things: fast and get your flu shot. Okay. You know, I talked to my infection control expert practitioner yesterday, and we got a good one. I'll be honest with you. But you know, I asked him the simple question: What do I need to tell these good folks about flu season? And I got about an 8-paragraph infection control based email. And I sent back and said, "Man, I'm impressed." Now tell me in dumb administrator language what that really means. He basically said, in his opinion, and again, it's just an opinion, so media or whoever, don't run out and say this is the absolute truth. It's just one professional's opinion, he sees it, everything he's hearing is gonna be, basically similar to last year. But who knows? I mean, it's a guess. A shot every year is the best clinical guess of those guys that put those tests together, those vaccines together. We've seen a couple of cases in the hospital already. Nothing like, late 17, early 2018. I see my colleague Steve Daugherty out there. He can probably tell you back to 17 and 18, there wasn't a bed in Middle Georgia. And I'm serious. And I'm not talking just Macon and Houston County. You had to go a long way to find a hospital bed for several weeks consistently there. So hopefully we're not getting there. The indicators are not showing that, but we'll see. Like a lot of hospitals, we have the policy that we've not done it yet. I think some hospitals may have already closed down for children under 12 with illnesses. We've not done that yet, and that's not to say we're any better or worse for that. It's really just you try to read kind of the answer to this question. You try to read what kind of flu season you're having versus the customer service access you want to have for your patients and their families. And we've just not made that call yet to limit children under 12. But depending on what goes on, we may very well get there, and we have policies that allow us to do that. Hopefully we won't get there, but we do have that ability.
Get your flu shots.
Yes, get your flu
So
shots.
as we prepare for our last couple of questions, I want to remind you guys, there are note cards on the tables. If there's anything that we haven't discussed that you want to hear about, or anything you want to hear a little more about, now's a great time to jot that down. The chamber ladies are around the perimeter of the room. You can just hold your hand up and they'll be sure to take your questions. So flu season's upon us, and right after that, our state legislature kicks back up for their next session. From a healthcare perspective, are there any developments at the state or federal level that we need to be looking out for, or that we could assist in any way?
Yeah, we've just come off a very active session for healthcare. I haven't seen any of the guys here today. Let me first say, I'd say our local, state, and federal delegation, just awesome. I have found that anytime we need a message delivered from Houston County in any industry, our guys are there front and center, ready to hear, ready to help, ready to deliver the message, and I've never gotten anything less than you got it. Help me understand it, which is fair. Let me tell you what I'm hearing on the other side, which is fair. But I got you, and let me take it. I'm going to represent Houston County. We're going to do the very best we can. So I just encourage everybody. I know this crowd knows this, but if you don't have a close relationship with the local delegation, I would encourage you to get there, take them for a coffee or a lunch or something, establish those relationships, because they're a great group of individuals that are willing to do what's right for Houston County. But last year, there was a big debate, certificate of need. For those of you that don't know, and I won't spend a lot of time, but that's a law in Georgia that basically regulates how services and certain capital expenditures are approved within the state of Georgia. You just can't go out and start a hospital or a surgery center, or you can't go out and just spend $20 million on something. You've got to get some state clearance on that. And there's a lot of detail to that plan I won't bore you with, but there's a robust debate at the state capitol as to what we need to do with certificate of need. There's some on one side that say completely abolish it. There's some that say leave it alone. Like most things politically, I think the best thing is probably somewhere in the middle. We didn't quite get to the middle. We did get some changes to the CON this year. Really, the changes to the CON law were not all that significant. The significant changes to the CON were the addition of some transparency rules that not-for-profit hospitals have to follow, and that went into effect actually Tuesday, October 1st, with some required posting of information on our website. Me personally, I would say 95% of what we're required to post was already publicly available. If you wanted to find out virtually anything about Houston Healthcare or any other system in Georgia, not-for-profit, in fairness, if you knew where to go, you could find it. Well, this law, from my perspective, just says, all right, guys, now you got to get it all together and put it on the website. So we've done that. We're compliant. Who knows what's to come with that? The federal and state level, they are debating the surprise billing issue. again, I think that's a legitimate topic. This is basically where you would come into any hospital. You expect there's certain services you're gonna receive, potentially, anesthesia for surgery, hospitalist group if you're inpatient. And some of these groups sometimes are not in the same insurance plans as the hospital. And you wind up getting an out-of-network bill when you have really no control as a consumer over that bill. And I think that's a very valid discussion that needs to occur. The state has taken it up a couple of years now. I'm not exactly sure where they are currently on their discussion, but at the federal level, it's a discussion as well. I think we're gonna see either at the state or federal level some legislation that mandates that it's essentially when you go to a hospital, your emergency group, your pathology group, your anesthesiologist, your hospitalist, those type groups where you're subject to get those surprise billings. We work with all of our providers, we have contractual language that urges them to be in the same network, but we can't really require them to be in the same network, and that sometimes can cause an issue with the consumer, and I understand it, so that's a good one to debate. Those are the ones that come top of mind. They did approve this year some telehealth legislation, which should make some payment for providers, give some payment parity to both ends of telehealth. So if you're either the physician that's providing the care to rural Georgia, or you're the provider on the other end receiving the information, there's some billing parity there that was passed this session. So good activity. I don't think the CON thing is gone. I do think that's going to come up again. That would be my comments on what's going on legislatively. And again, I guess the third takeaway: get to know your delegation and work with them.
Fast, flu shot, know your delegation.
That's right.
Got
That's
it.
right.
Okay, very good. So back to the Aerovac. There are Aerovac insurance companies out there. Is this something individuals need to consider for that type of insurance, or do normal health insurances cover Aerovac? Do you know this?
I don't know. I tell you what I do know. I believe some insurances will pay for this, but it is not. That's part of the surprise billing. Actually, the air transport is one of the industries that is getting a lot of attention at the federal level, not so much at the state level, for the surprise billing. Because there are some balanced billings that go on in the air transport industry. Whether you buy their insurance, I can't speak for them. I know part of what they do is for rural areas where there may not be EMS access at all, or it's very limited. Where you're in a farming community and you're prone to those type of accidents. It's in my opinion, it might be worth the investment. But if you're in an area where you got readily available EMS access, you might get it in the scenario we paint. If you were to come in with a stroke care and need to be transported somewhere else beyond just Middle Georgia, I'm not sure exactly how it covers that, but it's something you need to consider. I think if you're in those rural areas, I would definitely consider it. But if you're more metropolitan, I don't really know what the usefulness would be.
Okay. This is more of a comment, but reading it made me think of a question, so I'll give you the kudos first. So kudos to House and Healthcare for investment in the supply chain of tomorrow's healthcare workforce with internships for House and County Career Academy and CGTC, the CNA, EMT, and LPN programs. I know, seems like just a few months ago, may have been longer than that, House and Healthcare partnered with the Career Academy and the House and County Development Authority to host 50 students to learn more about health-related professions. Can you share a little bit about that program and any of the internship opportunities?
Yeah, I can tell you that I get to do. There's a lot of good things in my job, and that event was probably the highlight for this year. To be able to sit down with, I don't know the exact number, but 100 or so young kids that are in our school system, and talk to them about healthcare careers, not just the ones we always talk about, nursing and doctors. Those are critical as well, but talk to them about IT and engineering and finance. Very rewarding. And I think it's been a huge success. We have taken on a number of interns. Mike, how many?
18.
About 18 we brought into our organization to give some part-time hours working with the Career Academy. It's just a tremendous opportunity to expose healthcare, all healthcare careers to our young people. And it's just been fantastic, I believe, for our community and our hospital. One thing along that on the education I would like to point out, I mentioned that we'd be making an announcement today, and we'll probably do a bigger celebration publicly down the line, but I mentioned Dr. Davidoff and Dr. Skelton are here with us today. Some of you all may know Dr. Davidoff is a cardiologist here in the community, but I want to introduce her today as the new dean of the Trinity School of Medicine. And I'll tell you a little bit more about that. And then we have Dr. Doug Skelton. Some of y'all may know and recall from his days working with Mercer Medical School. He is the chancellor of the Trinity School of Medicine. Trinity School of Medicine is located in St. Vincent and Grenadines in the Caribbean. And we have recently entered a relationship to where we will be developing a medical school campus in Houston County, here in this building, and on our campuses at Houston Medical and Perry Hospital. We brought in the first 4 students. These are 3rd and 4th year medical students. They do their classwork down in the islands 1st and 2nd year. And then 3rd and 4th year will be here in Houston County. Again, Dr. Davidoff is the current dean, and she's doing a good job getting our local medical staff to sign up and agree to all the accrediting requirements to be a faculty member with our local medical staff, our local medical community. It's just tremendous. We have 4 students that started Monday, and when this thing is fully developed, we have the potential to have 105 medical students in our community. And that's 105 students, families, buying, shopping, living. It's a tremendous economic development opportunity, once again, for Houston County, and we're honored to do it. It's still in its infancy, but we do have 4 students that showed up Monday morning doing their rotation. So this is a big deal. You'll hear more about it in the future, but this is really the first time we've spoken publicly about the Trinity School of Medicine relationship. It's a big deal.
That's very exciting. Absolutely, yes, yes. And if they have any time to have a social life, we'll plug them in with our Young Professionals program, and get them engaged, because much like the Houston County way with our school system, we want to keep them here. We want to keep them in the workforce. Once we get them into the schools with kids in schools, it's definitely an attraction factor, and this is an exciting opportunity to continue that pipeline.
Very much so.
Very good. I'm going to read this one the way it's stated, because I'm having trouble with the handwriting. Regarding the athletic trainer discussion, are there any partnerships with Robins Air Force Base that contribute to airman readiness through fitness and lifestyle education?
Specifically to those 2 items, but we meet routinely with representatives from the base, and we stand ready to, as needs are identified on the base, that those come out in that those meetings, and we're able to try to meet those needs. Some of the things in the past we've done, we've been able to do suicide awareness and some education in that regard to help with that horrible issue on the base. This building, this room we sit in today, was a collaboration with the base very much in mind. Could they do their trainings here in this room, and then they do on occasion use this facility for their training. There is a training coming up where we're partnering with Navicent and some other entities around to provide some continued education to members of the 78th Medical Group here in this room. So excited to do anything we can to support the base at all times, and I think we've got structures in place to have those conversations, to identify those needs, and if those 2 are needed, we will put them on the list and get after it, because it is, we have a base in our strategic plan. We know their importance to us, and we'll do whatever we can to support the base.
Very good. Well, and I think just along those lines of learning about what Houston Healthcare does, every time I turn around, whether it's on social media or through your communication, learning more about a new program, or existing programs, for diabetes management, for prenatal care, for all of these other programs. So if you don't know if the service is available in Houston County, look. Their website is tremendously informative. They keep people up to date through social media channels on programming. There's a lot going on. I don't think we've even begun to scratch the surface of all of the different services that you provide. So with that said, that's my last question. Is there anything else that you'd like to share before we wrap things up?
Well, there was one other new service we're offering I want to be able to tell you about. And we're really excited. You know, our med stops in the community, we have 3 in the community, very robust. The most successful one, or the busiest one, depending on how you want to look at it, is the Lake Joy Medical Center, Lake Joy Med Stop. We recently extended hours there earlier in the year. It may have actually been end of 2018. Earlier hours in the morning, later hours at night. Again, back to what we were talking about with the employers, we were still seeing low acuity visits in our ER earlier in the morning and later in the evening. So we strategized that if we extended the hours for our med stop, maybe we'd get a more appropriate lower utilization or lower acuity utilization in our med stop at Lake Joy. And I'm telling you, we nailed it. Those hours have picked right up. They've been busy to the point where we have now expanded. It's not quite finished, but we're expanding Lake Joy Med Stop within the confines of that current building. And it should be finished by the end of 1st of November. And we have brought in a dual board eligible internal medicine pediatrics provider. Actually grew up in Eastman, Georgia, Tori Grenade. She's already on board with us. And then Dr. Barroso within the community has moved down and will be our other pediatric provider. And in the new addition to Lake Joy Med Stop, we will be offering pediatric urgent care at the Lake Joy Med Stop. We see that when we look at our numbers, it's about one in 4 of our med stops are pediatric, and we've really not staffed that with pediatric specific providers and put any kind of messaging to the community for it. So we're going to do that, and that should start around the 1st of November. So we're really excited about that. You know, just some other things real quick. Just walk around this building. You can see new physician services that we have. We've got, I'll name them real quick, Houston Urology Associates. That's Victor Andrews, Dr. Dan Dayton. Houston Behavioral Health Associates. We've just brought in 2 additional psychiatrists. Those are Dr. Dan Ianatescu, Dr. John Bocock, and Dr. Sheldon Brown. We've got Houston Diabetes and Endocrine Associates, Dr. Helena Klindakova. Perry Family Medicine Associates, Dr. Andrew Wang. I think you have a list of these on your table. And then right across the hall, Houston Vascular Associates, Todd Jenkins. And then we've had a new wave here towards the end of summer in August. I mentioned the 2 psychiatrists, but literally right across the hall, Houston ENT Associates is Dr. Nancy Butler. She's only been practicing a little over a month there, but she is off to a solid start. And then in October or November, depending on when the office is complete, we will have Houston Family Associates, Dr. Juan Velasquez, who is a current faculty member in our residency program, will be transitioning out of the residency program, and we will set him up as a family practitioner in this building as well, over on the south side of the building. We've been able to bring in 3 additional faculty members as needed for our residency program, so that's a big thing. And let me just talk about a residency clinic, by the way. We talk about residency, and it tends to get, this is like a selfish plug, a little bit of a commercial, but we talk about medical education, and the residency clinic is limited to medical education. It's not. That's a physician practice. I mean, if you're looking for a physician, a primary care physician, and you don't mind sort of walking the educational walk with a resident, with a faculty member there, you get great care in our residency clinic. So it is a practice. It's not just limited to whatever comes out for educational purposes from our ER. It is a practice, and they will accept you if you're interested and need a medical home. And then over the next 6 to 9 months, there's 3 physicians that we're bringing to the community where we're working with existing physician practices where we've recruited primary care into those practices, which is that's a tremendous win for the county. You can go anywhere in the country right now and you're going to find a primary care deficit. and Houston County is no different. So we're working, it's a mixture of, sometimes we have to employ, we prefer to work with existing practices, and we're doing both, where we have to, but trying to grow and meet the need, of our community for, medical care.
Overall, a very exciting story. Charles, thank you so much for sharing with us today. Thank you for sharing this facility with us month after month, to bring this programming. We certainly appreciate that partnership, and we appreciate everything that House and Healthcare provides this community. Please join me in giving him a round of applause.